Proposing new group therapy terminology. Hi, I'm Louise Fouché from OTGrow. Welcome to our YouTube channel where we discuss tools, tips, and techniques. And today we're going to discuss terminology in terms of group therapy. So we had a conversation last year about the history of occupational therapy in South Africa to mark OTAS's 80th anniversary. And one of the topics that came up in both of the conversations was terminology and how so many occupational therapists are using so many different terminology for the different groups that it is creating confusion not only for our MDT, but for occupational therapists in South Africa, and I most probably suspect worldwide. Different people are using different terminology. So I had a look at Rosemary Crouch Occupational Group Therapy book and in her chapters, and I just wanted to mention some of the terminology that she refers to here. And so there are groups like life skills, stress management, social skills, discussion groups, psychoeducational groups, gardening, reality orientation, leisure games and sport, art and music, woodwork, printing, ceramics, ADL, expressive and evocative groups, sociodrama, creative writing, bibliography, psychodrama, the interactive group model, and that is just from one source that we are reading all these different terminology. Socio-emotional groups are used, psychosocial groups are used, and at the end of the day, it just creates confusion. And if we as a profession cannot even streamline our terminology, how must our MDT follow what is happening? And in all of these, I haven't even mentioned CBT and DBT groups and play therapy. And so I want to propose that as a profession going forward, that we really simplify our terminology in terms of groups. And I think the beauty of it is when we present groups that is so occupational therapy in terms of occupational based groups, where we are focusing on improving one of the occupational performance areas, that we use two words, occupational group therapy and occupational therapy groups. I propose that when we are within our scope of practice and presenting groups uniquely from an occupational therapy perspective, irrespective of what type of group we are leaning into or approaches we're leaning into, that for our MDT sake, we only use those two different terminologies. I propose that we use occupational therapy groups for anything on the creative Vonadatoy model of creative ability, any of our groups that we use with our self-presentation clients and lower, which means it's not really a true therapy group because they don't have the ability to think abstractly, to really have the give and take in interpersonal communications. They can't fulfill norms. That anything lower we would call occupational therapy groups. And anything for passive participation and higher, we call occupational group therapy because it is group therapy in which we are really focusing on the occupational performance areas we want to improve. Instead of tongue-tying ourselves and getting us all confused and using a whole different terminology. Tell me what you think about these two terms that we could use. And what is your feeling? Would it streamline things for our profession or would it make it even more confusing? And do you have an alternative suggestion? Please pop in the comments below. In this coming week, maybe just spend some time thinking about how can we bridge and overcome this problem of ununified terminology throughout our profession. Drop us an email or in the comment. I'm really interested to know your take on this. In the meantime, happy facilitation.